going to start with Katy sharing her story and how she became involved with infectious disease. And we're not only going to talk about infectious disease, but we're also going to talk a little bit about sepsis, because as all of you know, when one is on the rise, the other one is on the rise. And so we're dealing with both those in our healthcare systems today, and they're rising very, very quickly. So I can't talk about one without talking about the other. Katy?
All right, thank you. Is working? It is. My name is Katy Granger, and 4.5 years ago, I survived septic shock and also another condition called DIC, disseminated intravascular coagulation, which is a complication that happens rarely with sepsis, but I was the lucky winner. So what ended up happening for me is I was living in Hawaii at the time, and I had been living there for 10 years in the area, for those who know, on the island of Kauai, which is the smallest of the major 4 islands. And I was living in Honolulu, which is an hour from the airport and an hour from the hospital. I had just come home from Los Angeles, where my daughter was going to school. I left this incredible city with its incredible medical care and got on a plane and realized when I got home I had a bump on my finger that seemed infected. And it was unusual enough that I looked at it and thought, ooh, I wonder if this is MRSA or staph, because it was a little bit purple, it was oozing a little. It was no bigger than a mosquito bite, but it did look unusual. And 6 months prior, we had had a huge flood. Move this over a little bit. We had had a huge flood in the Honolulu area. And so I was on high alert for infection, because I realized that, when you have a natural disaster like that and groundwater floods, we actually have septic and cesspools in our valley. We don't have any, community sewage system. And so we were very aware that things got dirty. And I was being very careful until I wasn't, which, after a few months of being very careful, you think, oh, it must be fine, I'm sure it's fine. And I just sort of forgot about it and quit paying attention. And then I came down with this little infection. So I decided to go to a healthcare center, which is very common with sepsis. I think over 50% of people that end up in the hospital later in sepsis, septic shock, anything like that, have gone to a community center saying, something's not right, which I did, and can you check me out? So my vital signs were strong at that time. I did not have sepsis, most likely. I had no indication of it. They did not make a mistake, but they gave me an antibiotic appointment, and they gave me antibiotics, and they told me to, certainly come back in if things got worse. It was a weekend, it was a Friday, and as I said, I'm an hour from the hospital, so they're like, here's a prescription for antibiotics. Start them tomorrow, and then if things really don't clear up, then you should probably go into the emergency room. So my husband at the time was on a fishing trip, and as I mentioned, my daughter was here at college. My older daughter had just graduated, she was living in San Diego. So I was home alone. And over the weekend, I conversed with several people. I had just seen some friends, so I was texting them. I never talked to anybody all weekend, which is something I like to stress with people, that anytime someone's sick, you should speak to people on the phone. Your elderly parents, your loved ones, your kids at college, anything like that. Don't let them get away with texting, because when a person texts, you can't tell if they're thinking clearly. And one of the big symptoms of sepsis is mental decline. So I was possibly showing signs of that, but I was masking it by texting. And of course, I said to my friends, don't call me, I'm just gonna text because I'm kind of tired because I've been traveling. So the lesson of many lessons came out of this for me. First of all, I did not know the symptoms of sepsis, and that's not my fault. I cannot undo the things that I didn't know. Most people do not know the signs of sepsis, and it's become my mission to share that as much as I can. So I will quickly say, I'm now on the board of directors of Sepsis Alliance. We use the acronym TIME. T is for temperature, which can be high or low. I bought a thermometer when I picked up those antibiotics, and I was taking my temperature all weekend, believing in my heart that if I was becoming sick from this infection, I would show a fever. That's not true with sepsis. I never had a fever, and I almost died in my bed. So it is something, a lot of people don't know that. It's one of my most popular social media videos is, do you know you can die without a fever? And people are like, what? No, if you have a fever, you don't send your kids to school. Surely that means you have to have a fever. Well, you don't. So the other, so I mentioned acronym TIME, temperature, high or low, always takes place with an infection, which I had. M is for mental decline, which is a really big indicator. I always tell people, anytime someone has something happening mentally, get them to the hospital. It's like something's going on. It could be a stroke. It could be a million different things. I don't care. I'm not a doctor. Just get them to the hospital and have someone monitor what's happening with them. So I did have mental decline over the weekend, which I'll mention a little bit about. And then the final symptom that we talk about is E for extremely ill, because what will ultimately happen is eventually a person's gut will be telling them, or they realize that they're sicker than they've ever been, and they'll say something like, I feel like I'm gonna die, I've never been so sick, or I have to get to the hospital, something's really wrong. You know, they'll really, just their gut is telling them, they're like, this is not normal. And anytime someone says that, just believe them, do not question them. It's better to be safe than sorry. So in my case, over the weekend, I was alone. I thought I was tired from traveling, so I wrote that off. I was sleeping a lot. I threw up on Saturday. I texted my husband. I don't have memories, but that's how we know, is because I texted him and said, hey, I threw up today after having this little infection. I'm sure it's nothing though. It was only because I took an antibiotic on an empty stomach. And he had no reason to doubt that. Actually, he never even saw the message until later in the day. But I was dismissing a symptom that would have been a good indicator. And the reason I was doing it is because I thought, well, I don't have a fever, I must be vomiting. So I proceeded throughout the day to sleep a lot. I went to bed that night. Sometime in the middle of the night I got up, and we know this because I had indications of this later. What I think happened is I had 2 steps into my bathroom. I got up in the middle of the night to use the bathroom, either to throw up or urinate. And then I either missed a step or forgot to turn on a light, which is unusual. I've never fallen on these steps before, but I likely fell down the 2 steps. Probably caught the first step with my left foot, which was broken, and then fell to the floor. I had abrasions on my knee and I had a sprained ankle when I went to the hospital. And then instead of calling for help like a person who's thinking clearly would do in the middle of the night, I went back to bed. And there's a possibility, and I hope this is what happened, there's a possibility that it happened at like 6 a.m. just as the sun was coming up. And I did at 6 a.m. text a friend, and I texted her that phrase, I have never been so sick, please take me to the hospital. And I didn't get as dramatic to say I was going to die, because I think people know well enough when you're writing things, it seems more dramatic. So I was thinking a little bit clearly and not saying that, but I thought I was gonna die. So she came and got me. I was unconscious. I was complaining that I couldn't walk. She helped me get to my car. She wanted to get an ambulance. Again, I'm in a remote area. I know, and she knew. The ambulance is 20 minutes closer to the hospital. They take forever. And I also didn't want anyone coming into my home and then having my neighbors freak out and start texting my husband. And I believe that I thought I was just dehydrated. And because I've had that happen before, where I got so dehydrated that I ended up in the hospital. They gave me a couple IVs and I left feeling like $1 million. So I think that's what I thought the outcome was gonna be. On the way to the hospital, we were about 10 minutes out, so it's about 45 minutes later, I started crying and saying, my hands and feet are on fire. And I was crying in the back seat and moaning and in clear pain. And my friend panicked and called the hospital and said, you've got to meet us, something, this is not the flu. So got into the hospital. Blood pressure was 50/30, which is very, very, very low. They immediately knew something was seriously wrong. I believe immediately they suspected sepsis. They started a sepsis protocol where they drew blood to test to find out what the pathogen was that was making me sick. They began giving me broad spectrum antibiotics because they didn't know what the pathogen was yet. And they began resuscitating me with fluids, large amounts of fluids. And I've seen my charts, so within an hour they actually had results back showing that all of my blood markers were indicating the markers for sepsis. At that point, my heart rate and breathing rate weren't crazy, but within a short amount of time, I went into the next phase of I was already in septic shock, technically, because I was in shock. But all of the symptoms weren't necessarily lining up to be the super clear. I mean, it was clear, but it wasn't necessarily the steps that we normally say for sepsis. So usually what will be happening when someone's in severe sepsis is that they'll be showing indication of organ failure. And one of the most common early indicators would be fast heart rate and breathing rate. So I use that when I'm talking to people about if you've missed the first signs, if you have the flu and you're not sure what's going on, if you start having breathlessness and your heart rate is is happening rapidly, get yourself into the doctor because you're already at that point entering the second phase. Some people have commented on my social media things saying, what about low blood pressure? And I'm like, ooh, low blood pressure is, yes, definitely, but you're really late at that point. And the risks of survival are much lower, and the risks of amputation are much higher, even for people without DIC, because at that point they're needing, oftentimes with the protocol, they're going to need to give you vasopressors, which are going to push the blood out of your extremities in order to save your organs that will be failing at that point. So I spent a day, I went on a Sunday, I spent 24 hours on Kauai before I was airlifted to Honolulu to the Level 1 Trauma Center, which is Queens Medical Center in Hawaii. My husband at that point, so throughout the process on Saturday, my 22-year-old daughter, she was almost 23, the one who had just graduated, became the adult in our family, trying to reach everybody. She had actually had a friend that had sepsis her sophomore year of college, which was just 2 years prior, and she lost her leg. And so she understood how serious this was, and her friend almost died. So she knew what sepsis was and how dire it was. And so did her sister. So they were very concerned. And we couldn't reach my husband all day because he was on the river fishing. So they did eventually reach him Saturday night, and he spent all night traveling to Salt Lake City and then flew and met me in Honolulu. He got there 1 hour before I did, which is lovely because he was able to be there through the whole thing. However, when I got there, I was rushed into the ICU and they told him, I'm not stable and we'll come out and talk to you, but just sit and wait till we get her stabilized. They came out and just said, your wife is very sick. If you have children or family members that should be here, you should call them and they should come. So my children did come either that day or in the morning, and they spent a week in the ICU with me, and they watched my hands and feet turn purple. They watched my fingertips turn black and shrivel up. They watched my toes turn black and shrivel up. It was clear even to a layperson that I would lose my toes and my fingers. I do have a lot of my hands. I'm really fortunate. I just spoke at Queens Hospital and I thank them profusely for saving them. I meet a lot of people in the situation that I was who are missing their hands or missing part of their arms or missing a larger part of their legs. And at the time I didn't think anything could be worse. When this is happening to you, you feel like, oh my gosh, I'm losing my legs. Like, this is the worst thing. I think you all know there's a million things worse. So, and I have now had some real awareness that, wow, people go through a lot of stuff in this world of medicine. And it's like there's a lot of people in hospitals for a lot of really horrible things. But I had incredible care there, and I just gave a talk at all the things that went right in the hospital, but I've also had an opportunity right now. There's a woman at Queens, as we speak, who's on, well, she was on day 3 out of the ICU with my exact story. Her hands and feet are purple. Her toes and fingers are going to be amputated. And she was just readmitted into the ICU because she couldn't get her breathing right once she was off the ventilator. So she's back on. And I'm pleased, for those of you who do pray, please say a prayer for her because she's going through this right now. But it is what we're trying to avoid. You know, mine was not a hospital-acquired infection. With sepsis, I think as much as 80% or more can happen in the community. So they come through the emergency departments, so it's important that it be recognized. Hers was not recognized as quickly. I mean, I would love to think that a whole lot's changed in the last 4.5 years, but it hasn't. They were on the way of sending her home when she passed out in the parking lot in the wheelchair that they were taking her to her car in. And then when they got her back in, 20 minutes after they'd taken her blood pressure, now she's down to 60/40 or whatever. And she's in full septic shock. And like I say, her life is hanging in the balance right now and she had been in the hospital for a couple hours, but they didn't recognize it. So we have a long ways to go. The other thing is, because of COVID protocols right now, my family was with me 24 hours a day. And I believe that my husband and my sister-in-law saved my life those first 3 days out of the ICU. They would wake me up when I would breathe, when I was sleeping, because every time I'd sleep, I was so highly medicated and so sick, and I probably still had brain swelling and all of that. My respiratory rate would go way down. They'd watch my oxygen levels drop. There's an alarm that goes off at a certain point, but they would wake me up and say, the alarm's about to go off. We don't want the nurse coming in because we're afraid she's going to take you and put you back in the ICU. And so they would make me do breathing exercises that they made into a game while I'd watch the numbers. And I remember I'd take these deep breaths, and then they'd go, okay, more. And I'd be like, you know, the deep breath that you take in yoga, and then it was like, and then I'd hold it, and we'd watch, and then every once in a while I'd go, beep. it would either take, usually about 2 breaths, but they were the biggest breaths I've ever had in my life. And they were exhausting, but they would make me do it. And then they'd say, once it's back up to 98, you can go back to sleep. And then we'd do it again and again. And I feel like it lasted for weeks, but it was only days. But it was because they were by my bedside. And right now, her family is not allowed to be with her at night. And I do believe, I truly believe that's the difference right there. It's like if her family had been there, if they'd been able to watch, if they'd been able to help. And we all know that there aren't enough nurses and there just aren't enough people to be with everybody to that degree. So I just am so passionate about the importance of families at the bedside, families in the care. And there were a lot of things we didn't understand. We didn't understand about ICU delirium, and there was no one whose job it was really to explain that. I was crazy for 8 days. This woman they literally, yesterday, they were giving her antipsychotics finally, and her husband was talking to me, saying, I don't know what's happening. I said, it's okay. It's normal. This is very common. It doesn't mean brain damage. It doesn't mean anything horrible. You just haven't, unfortunately, no one's really had time to explain this to you. And I've heard it said that, it's like in the medical field, they get used to the symptoms and they don't always know what a patient and their family isn't expecting. And so it was great that I could be there for them, but it would be even better if there was a system in place where there would be someone in the hospital whose job it was with every ICU patient to go through and explain, your patient, your family member may be crazy for the next week or so. Don't be alarmed. You can expect this. Another thing that was never explained to me, after everything happened, after I had my legs amputated a month later, I had my fingers amputated a month after that, by my choice. I wanted to wait. And then I had got the stitches out, and I was like, oh, my stitches are out of my hands, and my legs are coming in 2 weeks. I've been fitted for them. I'm so excited. And then my hair fell out. And I ended up having to lose all my hair and shave my head really tight and spent a couple months growing out that frizzy little hair that was still there. And I spent 3 days in 3 hours of therapy sessions about that. And I had only spent 3 hours prior to that talking about the loss of my legs. And so anyways, the importance of this is so in my heart, and I'm just so, listening to you speak today and listening to everybody speak and what you're doing here is just incredible, and I'm so happy to just share my story as a part of it. Thank you.
Katie, my story is a little different in that mine is a healthcare acquired infection, and it's MRSA. I have rheumatoid arthritis, and I had it in my large joints. And so in 2009, August 17th of 2009, I was having my 5th joint replaced. So I'd had a total shoulder, both hips, the other knee, and I was having my right knee replaced. Everything went pretty normal. I thought I knew everything about joint replacements. You would spend 3 days in the hospital, you'd go to physical therapy. The physical therapist and I had an agreement that I always knew what to do, and he would say, hey, Rosie, just call me if you need me, because by the time I got to him, I usually was already doing the things he was going to tell me to do. The first time I went to him, I remember he said, how come it was my shoulder that I had replaced first, he said, how come you're using it and you're reaching so high? I said, because I have a hatchback and I have children. How else do you think I close my hatchback? I have to use my arm. And so he said, well, some people wouldn't push through the pain. I said, well, somebody's got to close it. And so that was my reason for using my arm right away. And so, I thought I knew everything about joint replacements. And I did, pretty much. But about a week into it, I started having a little drainage and oozing around the staples. And about a half a week to a week after that, I went in to have my staples removed. Now, before I ever left the hospital, when I had the knee replacement, I already got my note to say I could go back to work in a week. Because I used my brain, I didn't use my body so much, so I said, just give me a note to go back to work. So I was already back to work, so I went in to have my staples removed on a Thursday night, and I said to the doctor, the only thing that's different this time is I've got this drainage or oozing around the staples. And he said, oh, it's probably because of an irritation from the staples. Once I take out the staples, it'll go away eventually. And so I'm thinking, okay, that makes sense to me. So I go home, and the next day I go to work, and It was summer hours, but I usually worked on Friday afternoons to catch up on paperwork. But by noon that day, and I had already changed my bandages 5 times. And so I thought, okay, maybe I need to go home and put it up my leg, and then the oozing will stop. So I went home and I put up my leg. By Saturday afternoon, I was wrapping my leg with bath towels because the bandages didn't even last an hour. But, you know, I kept hearing him say, it'll go away, it'll go away, it'll just take a couple days and it'll go away. And so by Sunday afternoon, I was wrapping my leg in beach towels because bath towels didn't even work. And I was changing them, and I was bleaching towels. And if you see the towels in my house, you'd laugh because they all have bleach marks. Because I couldn't, you know, I just knew this was an infection, but I didn't, you know, it just didn't make sense to me that it wouldn't stop. But I kept thinking, he said it would stop. He said it would stop. Well, Monday morning, I couldn't go to work, so I thought I'm going to at least call him and say, something's going on here. And he said, well, why don't you come in and I'll look at it. So I went in at 1 o'clock in the afternoon, and he looked at it and he said, I think we have a hardware problem. He said, I think something got on your hardware when we were putting it in, but I think I have a small window, and if I change it out, everything will be fine. So on Tuesday morning at 5 o'clock in the morning, I went to the hospital. At 7 o'clock, I was in surgery. And that was the last I remember of Tuesday. I don't remember anything after that on Tuesday. And usually, I'm the kind of person that by the time I got back to my room from recovery, it was like I hadn't had surgery because I was wide awake. But my husband said I never woke up that day. And on Wednesday morning, I had an interesting new doctor standing at my bedside. And he introduced himself as my infectious disease doctor. And he said, lady, you're very ill. You have a MRSA infection, a staph infection, and I give you about 30% chance of surviving this. And I'm thinking, what do you know? I've survived cancer 3 times in my life. You know, what do you think? I'm not going to survive a little infection. And so he probably said a ton of other things, but all I kept hearing was 30% chance of surviving, and I'm thinking, you're crazy. You know, and so he left, and I decided that I was going to answer emails. So I opened up my computer, and I start to reach and try to type, and I can't. I can't do anything. I can see myself trying to do it. I call it my out-of-body experience. Now, nobody was telling me I was in sepsis or had septic shock. Nobody said those words. Nobody said anything about that. But I knew that all of a sudden that I was very ill because I could see myself trying to type on that computer, but I couldn't do it. So I thought, okay, I'm just going to lay back and sleep a while. When I wake up, everything will be fine. Well, it wasn't. And I was in the hospital for 10 days. I was back to surgery 3 times in those 10 days to clean out the wound. By the time, you know, by the time I left, I was told that, you know, this staph infection was getting worse and they might have to change the hardware again. That led to eventually 58 surgeries, over 200 hospitalizations, over 100 blood transfusions. I've had been in septic shock more than 14 times. There were times when they didn't tell me, but now when I look back, I knew. And you know, my sepsis is exactly like Katy's. I don't run a temperature. But I have, what I do have is I have what I call my fuzzy brain. And I realize that my brain is going fuzzy, but I don't want anybody to know. Because I don't want anybody to fuss over me. So my husband would, and all of a sudden, but then I would start slurring my speech, and my husband would say, what's going on, Rosie? And I'd say, everything's fine, everything's fine. And he'd go, no, it's not, because you're slurring your speech. Well, then eventually he would end up calling the ambulance, and I would end up having out-of-body experiences. I've been intubated multiple times. I've been flighted from one hospital to another hospital multiple times. I've been in comas. I've had multiple different things happen to me because of this. Originally, they kept changing the hardware and changing the hardware. They would put in temporary hardware, or they'd put in the regular hardware. Nothing would get it to heal. At one point, they sent me to a plastic surgery because there was no tissue left to close the wound, so they were trying to find another place. And he's the first person that said amputation to me. I remember calling the orthopedic surgeon on the way home from talking to him and saying, "You sent me to a plastic surgeon to tell me about amputation? You didn't have the decency to tell me yourself?" And he said, "Oh no, I don't plan on amputating your leg." He said, "Before I do that, I would fuse it." And I said, "Well, okay, let's talk about fusing it because this is not working." So he said, "Well, you'd have a little lift." And I'm like, I could live with a little lift, if, and I'm thinking little lift, I've seen people that have had like a quarter inch lift. Well, my lift was 6 inches because that's how much bone I lost. And, but I still was perfectly fine. I was still, getting around, still working, still doing all the things, still believing it was going to heal. 6 months later, it still hadn't healed. I was still going back and forth to surgery. So eventually he said to me, "I've never amputated anybody. You're going to be my first amputation. But I think we need to amputate." So he amputated me 6 inches above my knee. He originally said it would be just above my knee, but it turned out it was 6 inches. But he said, we'll plan on getting a prosthesis and everything will be fine. And I'm like, okay, that's great. Well, before I ever came home from that amputation, I was already told, because I'd gone back to surgery 4 times before I ever came home, because it kept opening up and draining, that I would never be able to have a prosthesis. So my hope of walking again had been kind of wiped out. And so I knew I wasn't going to get a prosthesis, but I still believed it might heal. And he thought it would heal. And for the next 6 months, I spent going back and forth between the infectious disease doctor, who said, "Here's your CAT scan. It looks like you have an infection at the pelvis and at your hip and on that femur." And the orthopedic doctor saying, "I'm just going to clean it out until the end of the tunnels." And so he would clean it out to the end of the tunnel, and so I felt like this yo-yo, because one doctor was telling me one thing, the other doctor was doing the other. I was seeing the CAT scans, and it made sense what he was saying. So eventually the infectious disease doctor said, "Rosie, I think he's not doing you justice. He's not listening to me. He's not hearing me. He doesn't think I know anything about orthopedic surgery." And so he said, "Would you consider going to see a friend of mine that I went to med school? He's an orthopedic oncologist, but he deals in weird things." And he said, "I'm going to tell you, this is the weirdest case of MRSA I've ever seen." And he said, I want you to, would you go see him?" I said, "Well, I'm sick of this argument and I'm playing yo-yo between you 2 doctors. Definitely, I'll go see him." So I went to see the doctor, and he said, "I'm going to put you in the hospital for 14 days. I'm going to open up your wound all the way to the pelvis, and I'm going to, then use an internal vac. It's a brand new vac. I'm going to use an internal vac, and I'm going to take you back to surgery every other day until we start growing healthy tissue." And I said, "That makes sense to me. Let's do that." He said, "Probably take 14 days. It'll probably be 7 surgeries." I'm like, okay, I'll deal with that. Well, when he opened it up, it turned out there were 17 stitches that hadn't dissolved from the first amputation. They were now infected with MRSA. They had infected the little piece of femur I had left. It had infected the hip joint that was my artificial hip joint, and most of my pelvic bone. And so those 14 days turned into 40 days and multiple surgeries. And still, and eventually I went home with a vac. I should own stock in vacs because I probably could be rich. But I've had every kind of vac you want in the world, and it still wouldn't heal. It just wouldn't heal. And so eventually he said, "We're going to have to take the artificial hip, your femur, and most of the pelvic bone."
So what's your time period here from your initial surgery? Because you keep saying 6 months. How long a time period were you going through?
Well, it finally was healed. This happened in 2009. In 2017, it finally was healed. And it still can open up at any time the minute I get an infection. But so it turned out that they removed my hip joint, my femur, and most of my pelvic bone. I went home, and I was doing pretty well. About 5 days after being home, I said one morning I got up and I just was not feeling right. And I said to my husband, I think I'm going to pack. I had an appointment with the doctor the next day. I said, I think I'm going to pack a bag because I think I'm going to end up staying tomorrow. And he said, why? And I said, I'm just not feeling right. And he said, okay. And he kind of went along with me. And so I kind of slept most of the day, and I was sitting in my recliner, and all of a sudden, about 4 o'clock in the afternoon, I reached down beside my self and pulled out my hand, and it was all blood. And I said, David, I'm bleeding. And he said, well, let's get you in your wheelchair. Maybe it's you bled through your bandages. Let's get you in the wheelchair and see where it's coming from. And he got me I literally was like this. I was like one cheek on and one cheek in the air, and it was just gushing blood. And so he's like on the phone dialing 911 and calling the ambulance and trying to stop the bleeding, grabbing anything he could. And the ambulance came, and usually there's a hospital within less than 3 blocks from my home or my apartment. But I never went to that because it was a 21-bed access hospital. We call it the Flight for Life Hospital because you end up there and they flight you somewhere else. So I never went there. They always took me to the hospital where I had the initial surgery, which was an hour away. But when they got me in the ambulance, they said, Rosie, your blood pressure is 65/45. You are not going to make it to Appleton. You're not going to make it the hour away. We're going to take you there, and let's hope we can save your life. So they took me over to the 21-bed access hospital. I can tell you that emergency room doctor saved my life that day. He immediately started pushing blood, but he immediately also called the hospital where I had the surgery, which was 2 hours away. He also called Flight for Life. By the time my husband locked the house and drove over to the hospital, David walked through the door and he said to David, I've already called Flight for Life. I've already called Freighted Hospital. They're expecting her. I'm flighting her as soon as I can get her stable enough and get enough blood into her. So one of the things that most people don't know, that before they put you on Flight for Life, they ask you a question. The question is, do you want to live? Because they're not going to spend the money on putting you on Flight for Life if you don't want to live. And I'm like, well, what do you think? I want to live. I've been through all this. I want to live. So I get on the Flight for Life, and I've got this. Flight for Life is not the way it's in the movies, because you kind of like, I call it the meat tray. You kind of get slid in, and it's like there's a seat here and there's a seat here. So I've got like a really young guy here, probably in his 20s, and I've got probably a lady that was a lot older than I was at that point on this side of me. Both of them, carrying a lot. Both of them being very, very caring. But we're flying over cornfields because between my house and the hospital where they were taking me is basically cornfields. And twice they asked me if I wanted to live, and I kept thinking, what are they going to drop me in the middle of the cornfield? I said, no. What is the deal here? I'm like, what do you think? And so, I get to the hospital, and they had sent David out earlier. They said, you might as well head for the hospital because we want to make sure you're there by the time she gets there. And so he, came in right behind me. And I remember landing on the roof of that hospital, and that lady who was a lot older than I was, running with my gurney. I mean, she was just running. I mean, it was like lights were flying past me. And and she'd get me on an elevator and out the elevator and down another floor and to get to the emergency room. And I got to the emergency room, and the only thing I remember in the emergency room is one thing, and that is David saying to me, looking at me and saying, you're having one of those out-of-body experiences. And I'm like, and he said, I think you're going into septic shock. I'm going to tell them. And that was the only thing I remember in the emergency room. Now, I thought that before they intubated me, they again asked me, did I want to live? And then I remember, like, I think I shook my head, but that's what I remember. But David said they didn't do that in the emergency room. That was done in ICU. They intubated me in ICU. And they weren't going to do surgery that night. And then at 1 o'clock in the morning, they called in the surgeon and said, she's bleeding so bad, we need to do something. And the surgeon's description of my surgery was that he literally took off the vac. And when he took off the vac, he said it was right out of a movie. He said he was blood from head to toe. His resident was blood from head to toe, and the nurse was blood from head to toe. They, all three of them, jumped on the bed with me and tried to find the bleeder. He already had called vascular surgery, trying to have it, but by the time they got there, he had found the bleeder, had sewn it off, basically gave me enough blood and plasma and platelets. I had 19 units of blood, plasma and platelets that night. He basically got me stable. And then at 5 o'clock in the morning, he went out to talk to David, and David said he saw him walking down the hall. Now, this surgeon was like the card of cards. He always had a joke and always a story. But David said he saw him walking down the hall, and he was sure he was going to tell him that I had died, or that that's what he expected. And what he told him was, she was down for so long, I don't expect her to have her mind or her kidneys when she comes to, if she comes to. And that was what David lived with, and my family lived for the next 6 days. And but I came to, and that's the story about Stephen. When I came to, my iPad had blown up because I had been doing all of this patient advisory work, and I had been planning to go to IHI and do a presentation with Stephen and another young man from Indiana. And so my daughter comes in, and she's like, Mom, who's this person? Who's this person? And I start telling her who all these people are. And she starts crying. And I'm like, what are you crying about? And she said, Mom, they told us you weren't going to have your brain. And now you're telling us everything about your iPad. But I was different for a while. And I knew that I had a struggle for every thought. And my brother one day said to me, Rosie, you're finally back to normal. I said, what do you mean by that? He said, you had lost your sense of humor. You just didn't, it was like you had just lost a part of your personality, but now it's back. And I think it was I was struggling so hard to fight the part of my brain that was messed up. But it was the sepsis, it was, the infections, Katy's happened fast, mine happened over a long period of time. Eventually, it still didn't heal after that surgery. And eventually, the way they healed it was they packed it with Denkins, which is a combination of, is a bleach and water combination, and Curlix, and they packed it tight to the pelvis, and literally I let it fill in. Took 15 months to heal it. My husband packed it twice a day, because originally they said, oh, you'll have to go to wound care twice a day. Wound care was an hour away. So that meant I would have spent 4 hours on the road in the winter in Wisconsin. And so I said to the doctor, do you think David could do this? And he goes, well, is David squirmish? I said, have you seen the pictures we've sent you? Who do you think takes those pictures? Before I would drive all the way, 2 hours to a doctor appointment, I would send pictures saying, what do you think? Do I need to come in, or is, and so, I mean, if you look at my phone, there's still these awful pictures. And every time I think about destroying them, I go to a presentation by a doctor who shows those awful pictures. And I'm like, someday I'm going to get the nerve to show those pictures. So, my story has been told a lot, but I tell my story not because I want anybody to feel sorry for me. I want people to learn from it that one infection is too many. One person getting an infection is too many. And I call it storytelling with a purpose. I do a lot of work in quality improvement, in research, in measurement. I work with CMS, I work with UW University of Wisconsin and the veterans. I do, and then I also do a lot of work in quality. I've done work locally, I've done work nationally, and during COVID, it opened a new whole world to me, and I presented on 6 of the 7 continents during COVID. And so globally, I've begun doing a lot of global work, and in the middle of May 13th, I'm leaving for Copenhagen. and I'm doing the IHI International Conference.
Wow.
So that's my story, and Karen's going to share. Karin.
That's okay. Karin the Garage.
Yeah, Karin is
Okay,
going to share a little bit of, and she's a doctor, but also she has a story, but also the fact that why is our story so important to the work that she does.
So I'm really the support team here for these two, okay? When I was 5, my mom got endocarditis, an infection of her heart, when she was pregnant with my little sister. She had a urinary tract infection and 8 older kids running around the house that she was trying to take care of, so she ignored her own health until she couldn't. And she was in the hospital for about 6 months that year, and my little sister came home before my mom did, and after that, you know, she had an aortic valve replacement, and then she would have ischemic strokes and then hemorrhagic strokes, and then she ended up having to have her mitral valve replaced, and you know, just I was fortunate enough to have her in my life for another 18 years. So she died when I was in my 2nd year of medical school, but she was obviously the reason I became a doctor, and definitely learned a lot about the importance of patient and family participation. I can remember vividly not being able to see my mom because no kids under the age of 18 were allowed when I was growing up, on many an occasion where she would spend months in the hospital, and you know, seeing her from the window, you know, with my older brother holding her up. And then I got sick when I was pregnant with my child and was about to give birth, and it was hilarious because I thought I was having adrenaline surges because I was so excited about giving birth. So I'm there, and there's 3 other physician friends around me, you know, and they're like, wow, Karin, you're really excited about this. And I'm like, yeah, yes, I am. I'm really excited. And it wasn't me or any of the 3 of us, Stanford-trained physicians. It was the labor and delivery nurse that said, I think you're having Rigers. Let me check your temperature. And she was the one who called the OB and said, you need to come now and deliver this baby. And you know, my son came out looking like a punky 50-plus-year-old man who was mad. He was just like this, you know. And he had to be rushed off to the ICU and had great recovery and has since graduated from UC Davis. He's doing great. But this has led me on a lifelong interest in sepsis, obviously. And I started with training hospitalists and intensive care doctors on central line placement for the large hospital group where I worked. Because when early goal-directed therapy had come out, thank you, Manny Rivers, for bringing attention to this. And then I ended up working within the 24 hospital system, trying to work with nurses, respiratory therapists, ICU nurses, every level of care, lab techs, radiology, to try and come up with order systems, documentation that's going to work everywhere from the rural hospital to the quaternary care center where you've got medical students, PAs, nurse practitioners, and everybody else. And that was a wonderful experience, but still entirely frustrating because I was seeing all these patients come from the community that didn't know what sepsis was, so they were coming in looking like crud. And you know, 80 to 85% come from the community, so I'm like, I need to get out in the community. So I started giving lectures to EMS providers and the public. And at one of these meetings, I was lucky enough to meet the CEO of Sepsis Alliance, Tom Heyman, and he's like, hey, we need to talk. And I was lucky enough to join Sepsis Alliance as a volunteer and just pass the baton to someone else to take over the chairmanship, because it was one heck of a time period during that pandemic, I have to tell you. I was giving COVID lectures in March of 2020 to the lay public, just trying to say, you guys, please wash your hands and wear a mask, you know. But it was a wonderful experience. Did some work on public television. In 2018, I did this presentation on what the flu pandemic of 1918 was, and then was like, oh my God, we're having it happen right now. So I was lucky enough to meet Katy and Rosie in this experience with Sepsis Alliance. And my whole goal here is just to try and lift everybody up, to help everybody in the community, because not everybody can get to a doctor within 15 minutes. So we have to be able to educate families and family members and get family members back into the room with the patient. Or close friends that can deal with the blood and the guts and all that stuff. The challenge is we are so short-staffed in the world of medicine right now, and you've got an able-bodied, very committed individual who cares so much about that individual. You can teach them how to wash their hands. You can teach them how to put a mask on. You know, and I really, really think we had a huge pendulum swing during that pandemic, and we really, really, really need to bring the family and loved ones of any kind back in the room to help with that care. I really think that step one saved Katy's life. There is no way on God's green earth that Katy would be here today without step one, because what it forced was the local rural community hospital to have to get their skill set up to the level of Manny Rivers, you know, at Detroit Receiving. So I think that that was a really, really important part of the process. Yes, it's not a perfect beast. I totally get it, you know, but I think in the world of AMR, rather than telling physicians, don't give any antibiotics until you know what it is. In 50% of septic shock cases, we don't know the bacteria or the fungus or the parasite or the virus that might be causing the issue because we don't have good diagnostics right now. So my goal is to have people focus on the second dose, okay? We've got another 8 hours that have percolated there. Hopefully we've got more data points. Then we can reflect again to say, okay, what do we do now? So rather than telling ER physicians, don't give that antibiotic until you know how, you know, when you're dealing with someone with the systolic of 50, you know, you're gonna be like, okay, I don't know, but I'm suspecting sepsis. So think about that second dose.
So basically, you know, infections in general are serious. I don't know. Katy's was never diagnosed as MRSA, but it was environmental. Mine was healthcare. One of the things about environmental, it moves much faster than sometimes the healthcare does, but they both are devastating. I have to tell you that not only did I end up with MRSA, but along the way, I ended up with C. diff because they get, you know, the amount of antibiotics they used at some points. I ended up gram-negative, this kind of infection. That the more time you spend in hospitals, the more infections you can get. There's some definitions here about, you know, basically infections in general from CMS, sepsis, septic shock. These are all going to be available to you. You know, sepsis is life-threatening. It's a condition that, you know, when you describe it, it's their body shutting down. And, you know, and it doesn't, it's the leading cause of death in healthcare spending globally. It's the leading cause of death in life and healthcare spending globally. Here's some of the cornerstones. I believe that the only way that we're going to solve the problem of healthcare-acquired infections and sepsis right now is by going back to basics, by hand hygiene, by looking at oral care and pneumonia prevention, by wound care, making sure catheters and urinary care is taken care of. You know, all of those early signs, all of the kinds of things we talked about, those early interventions. I have to tell you that I went into septic shock in my infectious disease doctor's office one day, and the infectious disease doctor looked at my husband and said, "What's wrong with her?" And David said to him, "She's having an out-of-body experience. She's going into septic shock." And he goes, "I've never seen this." He said, "I'm the guy they call when you're in the emergency room and they call and say, we think this person is septic, and what do you prescribe? What are the orders?" He said, "I have never seen that at this stage." And so David said, we're 3 blocks from the hospital at his office, and David said, "Well, I'm just going to throw her in the car and get her to the hospital. He goes, oh no, I'm calling an ambulance, and I'm riding it with her in the ambulance to the hospital. And that's exactly what he did. And he learned a lot that day. He learned a lot about what it's like, and immediately created what I now was my own personal bundle, and basically said to the ER people, if Rosie shows up here, this is what you need to do. This is, this is why she's here. She doesn't have a temperature. There's no sign that she's going septic, but she's in septic shock at this point, and none of us knew it. And all David said was, she's having one of her out-of-body experiences. And that's, and I know because she's not communicating with any of us. And then, I know hospitals are afraid of this one, but this is the only way we're going to survive sepsis, and that is the Hour 1 bundles. It gives a lot more power to ER nurses and nurses trained in it. And I've gotten some pushback from hospitals saying, yeah, but do we really want to give all that power to ER nurses? Well, I'm going to tell you, ER nurses are going to save your life a lot faster than somebody that you're going to wait on the phone for to give orders.
By the way, happy nurses.
Yeah.
Yes.
Yes.
Hospital week too.
Yeah.
Right. We have 2 minutes? Okay. And then, early screening saves lives. 85% of sepsis cases enter through the ER. And how do we save those lives? We save those lives by, looking at these therapy bundles. And this is going really back to what we talked about earlier. What are you going to do next week? First of all, I know you're all strapped. I know all of healthcare is strapped. And so before you decide to do something differently next week because of what we said here today, think about what you can stop, what you don't need to do. We're all doing tons of things we don't need to do anymore. Also, use your own personal experience and knowledge. And I think we said it very well this morning, you don't have to be perfect. You don't have to be perfect. You don't have to have everything down to perfection before you do something. And then I'm doing this at every presentation I'm doing this year. I'm telling you to ask your team members what matters to them. Our workforce is stressed and pulled in every which way. And they have got struggles in their lives that we don't know about. And we don't even know about the person working next to us, what their struggle might be. So ask them what matters to them.
I just have a really quick question. Katie, you had mentioned that one of the key signs is, I've never been so sick in my life.
Yes.
So is there anything else that a person that's not a clinician and doesn't know anything about this can look for and say, check for sepsis?
Yes,
Fuzzy brain.
Yeah, brain fog. So mental decline can be brain fog, sleepiness, difficulty waking them up, slurring their speech. Signs of temperature, would be shivering, shaking, just aches and pains, flu-like symptoms, vomiting, just any sign of illness. You don't always know when you have an infection. So mental decline kind of ends up being a biggie because you don't get that with a lot of things, but whenever you get it, it tends to be pretty serious.
So maybe the other thing is, there's a reason they're called vital signs.
Yes.
They're kind of vital, okay? So if any of you have a wearable, you know what your regular heart rate is when you're fine. You know what your heart rate is when you get a little excited after a cup of coffee. So typically, the old classic definition was, for SIRS, was infection plus some abnormal vital signs plus an elevated white blood cell count. So I looked for a very elevated heart rate, a very elevated respiratory rate, high or low temperature, and then elevated white blood cell count or very low white blood cell count.
And I also point out to people that you can hear that on the phone. You've said to your friends, we've all been on the phone, and you're like, are you working out? And they're like, oh, I'm taking my dog for a walk. You can hear that they're a little breathless. If you hear that with someone you're talking to your kid, your parent, your husband, and they sound a little breathless, always ask, what are you doing right now? And they might say, oh, I'm laying in bed, I just don't feel great. Big red flag, and you can detect that.
I think what I hear is when you guys were describing your symptoms, that it was a combination of symptoms. It wasn't just one thing.
It's a syndrome, yeah.
Yeah, and it kind of progresses. You start out with that fuzzy brain, and then you start slurring your speech, and then it's the next thing and the next thing.
And on that note, there's plenty of people who have the flu where they spike at 10 to 103 and their heart rate goes up to 110, but they drink a lot of fluids, they take some Tylenol, and it corrects quickly. So again, you want to look for those abnormal vital signs to be continuing, right? Exactly. Teamwork makes the dream work.
Right.
You know, and the thing is, the patient is a part of the team. The patient's family and loved ones are part of the team.
I'm a firm believer that, you know, I know me, but I don't know medicine. And so the two have to work hand in hand. And when I look at physicians today, and when I put my team together, it's people who hear me and to say, yes, I hear your story. I hear what you're talking about. And I, you know, I don't believe that I have the answers about healthcare, but I have the answers about me and about what other patients have experienced. I've interviewed more than 50 people around sepsis because in the beginning, I kept asking healthcare workers, have you ever talked to your patient about what they're experiencing during sepsis? And they would say, no, we just treat it. And I'm like, ask them the question. Ask them the question. What was their experience? And I would go to every conference and I would go to every sepsis presentation and I would ask that question. Because it's like, somebody needs to like start talking to the patient about what their experience is. And not everybody's experience is exactly the same, but there's some key elements in everybody's that is the same.
Thank you. I know we went a little bit over. It's about 5 minutes after 11. We started a few minutes late. The next session starts at 11:10. I want to say a big thank you to Katy, Rosie, and